All right, hi, Dr. Landon Pryor here with Pryor Health, and welcome to the Emerging Trends in Breast Implant Illness Summit. We're excited to share a lot of information with you. You'll hear from 4 of our medical students through University of Illinois in Rockford that are doing research with U of I and Pryor Health to better understand the pathogenesis of breast implant illness. And then Laura and I will just talk briefly about kind of our own personal experience with breast implant illness. We have kind of different perspectives, different but aligned perspectives, because she's been in the Explant community now for 30 years, and she can share with you kind of her story related to breast implants and breast implant illness, and we'll take it from there to kind of my history with breast implant illness, how we met, and where we're at now. So with that, Laura Bowden, so she's our breast implant illness patient advocate. She's very passionate about managing and treating patients with breast implant illness. She's phenomenal. I mean, I can't even say enough good things about, the value that she brings to, the whole patient experience as it relates to patients getting their implants out. So very happy and grateful that she's part of our team. And, with that, she, has her own story. So this is going to be very raw and organic, and we've got a box of tissues here
I already felt it happening.
If we need it. So, Laura, take it
I'm
away.
going to try to do this without tears.
Yeah,
so
right.
with that being said, the first thing I'm going to say,
5 minutes.
5 minutes.
Time it.
Yeah. So we do have the nickname of Dr. Pryor and the Crier, and there
Yep.
is, he just hit it on the head. I am incredibly passionate about this population of women that have suffered for years. And with that being said, 30 years ago I had breast implants, 26 years old. Was very ill. It was basically my gut was telling me that it was my breast implants that were causing me to be ill. So I decided to go back to my plastic surgeon, because he would share with me that, yeah, this is why you're sick. And I went to my surgeon and said, I'm very sick, and if it's my breast implants, please tell me. And tapped me on the knee, to be exact, and said, I will take your implants out under a local. There's no scientific data to show that that's why you're sick, but if that makes you feel better, that's what I'll do. Which makes it very interesting. There's no scientific data. So as we as a practice are trying to get that scientific data 30 years later, it's almost going to happen.
That was even 5 minutes.
Is really surreal for me to be sitting here with this, I'm going to be nice to you, this brilliant surgeon that is brave enough to courageously go into this and believe the BII community is huge. So I was scheduled to have my implants taken out by this surgeon, and I was watching Jenny Jones talking about being sick about her breast implants, and it was like, oh, so I'm not crazy. Women are sick. There was a number that scrolled with the support group. I called that number that night, and my angel was named Vicky. She answered the phone, and she directed me into the right doctors that were believing in silicone adjuvant breast disease, is what it was called back then.
This was like 1990?
1992.
So early 90s. So that's actually right when I met Jenny Jones. It was
Oh, for real?
Around that time period, yeah, because I was like a junior in high school.
So I had reached out and got in contact with this woman who guided me to to a neurologist who was doing a study. So I went to Bowden University, and I met 3 floors of sick women. And that's when I realized that I was not alone. And I got my implants taken out by somebody, that Dr. Hamilton, that knew how to do a proper explant, which, think about that, 30 years ago, en bloc, we didn't even talk about what an en bloc was. So for me, that was literally a gift from God to spare me to being sick for many years. So I got them out, and I got better within 24 hours. It was like a light bulb moment for me. The symptoms were chronic fatigue, muscle twitching.
How long
dry
after
eyes.
you got implants?
4 months.
4 months, okay.
4 months. That's how fast it started. But again, it is a gradual, just gets sicker and sicker, doctor after doctor, IBS issues. I couldn't finish my sentences. My husband would finish my sentences. And you know what happened with me? I stopped talking and I stopped laughing. It literally steals your joy.
So like brain fog?
Yeah.
What else?
Chronic fatigue, IBS issues, dry eyes, inflammation, weight gain. I blew up like you wanted to just pop me with a pin.
And you went to the doctors?
Every doctor.
And
they
what
told
do they
me I
say?
needed to see a psychiatrist.
Okay.
There's nothing wrong with you, because, as we know, all these blood tests show that we're perfectly fine. There's nothing wrong with us. So our patients, as like I was, we are the sickest, healthiest on paper that you see. And that's where it comes that this continues for years and years and years because there's no diagnosis to this. Mm-hmm. So I got them out, got better, and came back to Illinois and decided I was going to be a voice.
So you had the symptoms for 4 months, and then you explanted
2 years later.
2 years later. So you had the implant for 2 years,
Mm-hmm.
or 2.5 years. 2 years total.
Mm-hmm.
And then they did the full en bloc capsulectomy, even though it was not really
Mm-hmm.
established at that time. That's what they did for you.
Yep.
But you didn't see pictures. You had no confirmation that they took all
Nothing.
that out. So you just
Nothing.
assumed that what the doctor said is what he did.
Mm-hmm.
And then you noticed resolution of your symptoms.
24 hours.
All of them.
Everything gone.
Completely gone.
Completely gone.
So what would you say to opponents potentially that would tell you that it was all in your head? That there's no legitimate medical reason that you got better?
I would say, which one of my favorite saying is, we can't make this shit up. I mean, we get better. You know, it's not, it really is not rocket science. We watch it every single day. And I lived it. So when I see these women that are so sick and I see them get better, they say, will I get better? You know, I lived it. So I just started, you know, I thought, okay, where do we start? So where we started is we put a little ad in the newspaper.
Mm-hmm.
Because what else did you do? In the Northwest Herald. And women came from underground.
In the print paper. Back in the day.
Back in the day. In the print
So fast
paper.
forward, what year are we now?
We're in 1994, 95.
Okay, so I'm just graduating high school, just to kind of keep the context.
Mm-hmm.
But okay, so now you put an ad in the paper.
Yep.
Pre-internet.
Yep.
Pre-cell phone.
That's
Okay.
it. And women just literally came from underground. The support group grew like so large we ended up having it down in Chicago at DePaul University. And
How many people
I
at that point?
probably had in the group probably 130 in the support
And
group.
these are patients with implants
These are
that
women.
want to get explanted?
Mhm. These are
Okay.
just really, really, really sick women that have been sick for years, rupture
Okay.
after rupture after rupture. The Oprah show called and asked if my support group wanted to be in the audience.
Okay.
Yep. And that's
Yep.
how I became
So
Oprah Laura.
What year are we at now?
That was 1995.
Okay, 95.
That was
So
1995.
Oprah called, they said, come be in the audience.
Mm-hmm.
Now, were you kind of you were the leader of that group, so to speak?
Yeah, it was
were
my
you like
group.
an elected official or the president, or they just looked to you to
Well,
kind
I,
of make the recommendations?
yeah, Scott and I started the support group. So the
Okay.
women, yeah, so we got buses to go to Washington and picketed in front of Washington. And, you know, it was this beautiful group of network that was just through.
This is pre-Oprah.
Yep.
Before Oprah.
Yep.
Okay, and then
Yep.
they're like, okay, this is like
We know
an
about
interesting
you.
group. Yeah, we'd like to have you come on the show.
Absolutely.
And we're going to have the CEO of Dow Corning,
Mm-hmm.
and we just want you to listen in the audience.
Mm-hmm.
Little do they know that listening isn't a great skill set for you,
For me.
without being vocal.
Exactly.
Okay.
So I'm in the audience
Yeah.
through the whole show, and I actually sat quiet the whole time, which a lot of people don't know this. And the show was over, and Oprah made eye contact, and she said, "You have something to say, don't you?" And I said, "Yes." And she looked at the cameraman and did this.
I live here in Illinois, and I had implants put in 1990. Always a very healthy woman, never a problem. 4 months after, a series of problems started. Within 2 years, I went to every doctor you can imagine. Women, you have to listen. Please. They tell you it's in your head. You begin to think you're crazy. It's very real. It's not an open wound, so you can't see the pain. It is like you're dying from inside out. I've been there. I got them out, and I got better. And I see these women. I've been involved with this group for 3 years, 4 or 5, and I will not stop. You may have the money, but we've got the voices.
There was not a dry eye in the audience after I spoke, and she walked up to me, and she was crying, and she held my hand, and she just said, "You just saved a lot of lives today."
So what happened in the next 20 years?
Okay, there is a big gap. So after 4 years, I had 3 little boys. I needed to walk away because, it's gonna make me cry. Don't do it, Laura. It really did consume my life. I was gonna save every woman, just like my life was saved, and I just needed to walk away. It seemed emotionally draining, and so I am not kidding. It never came back on my radar. For all those years, I owned a nail salon, never came on my radar. And then 3 years ago, I met a beautiful soul. I'm a CrossFitter. She came into my gym, and I could see it in her eyes that she was sick. And I thought, oh, women are still sick. I realized that I had to come back out again. I wiped the dust off my VCR and my Oprah, and I put it out in the community, and it went viral. And a woman reached out to me and said, hey, we're doing a documentary with, you know where I'm going with this. We are doing a documentary with 20 sick women or women that got better. Would you want to be in it? I'm like, absolutely. And we reached out to every single plastic surgeon in Illinois to come speak to these sick women. And not one showed up but Dr. Pryor. And that was the day I met you.
So we said the implants came off the market in 92, 17 years goes by. Now 2005-ish, basically the FDA comes back and says everything's good, nothing to worry about. Silicone implants are fine. We don't show any scientific evidence that there's any correlation to any kind of systemic inflammatory disease. And that was actually when I started my plastic surgery training, was 2005. So right around that time, I'm learning everything about breast augmentation, breast implants, and, the messaging from everybody, implants are back, implants are good, nothing to worry about, go through the typical informed consent process. But, the message now to patients is, yeah, there was this big scare, implants were off the market for 17 years, but we've kind of gone back, we've done the research, and, essentially there's nothing to worry about, they were put back on the market. So, just plastic surgeons, make sure you tell your patients that, they're good to go with implants. So that was kind of what was going on, kind of leading up to me getting into doing, breast type of surgery, me and everybody else that was going through, training programs at that time. So I went into practice in, 2009, having done 7 years of residency and fellowship and very extensive training, general surgery, plastic surgery, craniofacial surgery, pediatric surgery, cosmetic surgery, breast reconstruction fellowships at very well-established institutions, ending at the Cleveland Clinic, a whole fellowship in breast reconstruction and cosmetic surgery. And not once, there's not a single word of breast implant illness. And not because anybody was hiding anything, but that just didn't exist. That wasn't validated. Kind of the messaging that we all heard was breast implants are good. So, we kind of assumed that was the case because that's what we were told. So I started in practice in 2009, and no problem, you want breast implants, we'll do breast augmentation like I was trained to do. Kind of patients going through breast cancer surgery. That was a very popular method of breast cancer reconstruction because obviously you have to remove a lot of breast tissue to do different types of oncologic, cancer type surgery. So breast augmentation with implants is a very popular way to reconstruct the breast at that time. Again, this is kind of 2009 forward. So now we're kind of talking in the 10-year period between 2009 and say 2018, 2017, 2018 when I met Laura. And so we're kind of going along, doing breast augmentations, doing breast reconstruction. Patients are happy, really no issues as it relates to breast implant illness. Also, kind of during that time, as part of reconstructive surgery, I did a lot of breast cancer reconstruction. We would commonly do these en bloc procedures for different reasons, not for breast implant illness, but for different reasons, reconstructive reasons. If we were doing something aesthetically to the breast, or if there was a ruptured implant that we would have to remove, we would do these en bloc capsulectomies. So I had all of that kind of technical training and background to be able to do this type of surgery. And it must have been about 2017 that, it's kind of, the timing's really interesting now that I think about it. I did a surgery on a patient who, I think I actually did her original augmentation, and then she came back to me and she must have done her own research as it relates to breast implant illness. And, I think she came in and said, I think this is what I have going on. I've been on the internet. There's kind of some emerging support groups that are talking about breast implant illness. And you should, really look into this because I think, these are the symptoms that I have. And I think that, and she wasn't confrontational in any way, just, wanted to feel better. So I don't remember the details, but I must have looked into it and said, okay, certainly we can't make any, just like we say today, we can't make any promises or guarantees that this is going to help you feel better. But if this is what you want to do, then, I'm behind you. I support you. I'll do the surgery that needs to get done to try to maximize your chances of feeling better if you're comfortable with the possibility that we go through the surgery and you don't have any improvement in your symptoms. So go and do it with that mindset. If you feel better, that's only going to be a plus, but I can't make those kinds of promises as part of the informed consent process. And she was fully on board with that. And we did the surgery and she got better. And so I'm like, that's interesting. And then I think, I must have had a number of other patients that started coming in around that time period. And it got to a point where I was invited to speak at kind of just like a roundtable support group here in Rockford with about 12 women, organized by a friend of that first patient. And they reached out to me because, they knew that I was doing this kind of work and that I had done some surgery on their friends and people in the community, and said, hey, will you come? It was like on a Sunday morning at like a coffee shop in Rockford. They said, will you come just talk to these women about breast implant illness and the possibility that their implants are creating symptoms? And I said, sure, no problem, I'll be there. So sat down with these women, talked to them for a couple hours, just kind of based on what I knew at that point about breast implant illness. And a couple of them were actually interested in doing something with me as far as explant surgery. And it was right around that same time frame that you didn't reach out to me, no. But through the same, I think, mutual connections, the person that was shooting the documentary, because obviously like the women are very tight in that community, reached out to me and said, hey, Dr. Pryor, like I heard you're advocating for breast implant illness. We understand you're doing surgery on patients with implants that are having symptoms. We heard you did this roundtable discussion and everybody was really happy with the information you presented. What do you think about coming to, it wasn't St. Charles, where was it? An event, would you mind coming to the suburbs again on like a Saturday or Sunday? We're putting together a documentary. There's going to be a lot of women there that have gone through this process, and we're trying to bring awareness to obviously the community, and we'd love to kind of get your perspective on what's been done so far. And so that was really where I was like, okay, yeah, I'm happy to help out. I want to get behind this movement. And in preparation for that, I just remember learning a lot about breast implant illness and really kind of going down the rabbit hole and digging into all of the social sites and learning everything I could, both scientifically, whatever was out there, kind of the research, the data, everything I needed to know to be able to speak intelligently about breast implant illness on camera, and then just kind of generally, what was going on in the community, understanding the support groups, kind of just really having a pretty good baseline knowledge of breast implant illness, because it wasn't something, even at this point in 2018, that you can go to like a textbook and look up, because it didn't really exist. No. And it wasn't, at this point, wasn't really advocated for publicly. It wasn't really part of mainstream media yet. This was actually pre-celebrities coming forward. It wasn't discussed really at any society meetings or anything like that. So I had to do my own homework and kind of learn about what it is that I was getting behind. So went to this documentary and shot like a 45-minute segment on breast implant illness.
And do you cover all the standard procedures that most physicians we've been hearing about haven't covered? Do you cover these with procedures with the women and informing them of possible side effects or any other outcomes?
So that's part of the quote-unquote informed consent process, which I heard some of the prospective patients allude to. And I think that is brushed over in a lot of practices, and women are totally given the opportunity to understand the extent of what informed consent is. Interestingly, when the FDA just met a couple weeks ago, one of the things that they want to improve upon is the informed consent process, because the documentation from the manufacturers is about 70 pages. So obviously no layperson or patient is going to be able to read through that and really understand what that means. So I think one of the main initiatives that they're trying to pass through right now is having an informed consent process, especially for breast implants, that people can understand, so that they're able to make an educated decision about potentially getting surgery with a device that's obviously a lifelong commitment.
That's where I met Laura, right? So just to kind of bring you up to speed. And so I probably spoke, and Laura, of course, comes up to me and said, "You're brilliant. That was amazing."
I did.
And
I'm so proud of you. And wow, you're
great.
brave. He literally entered the lion's den.
You're brave, and you're so cute.
No, you are so cute. He sat in the living room with 20 sick women, and they just drilled him, and he answered eloquently and honest, and he believed them. And that's the biggest thing, is that he believed them. And then he found out that I had been talking about this years ago. He's like, wait a minute. you were talking about this years ago, and he wanted every study I had, everything I had in my brown bag.
Yeah, so we said, I'm interested to talk to you more about this. There's something here that we should be doing together. She was very passionate about it. I was starting to see, significant improvements in the patients that I had explanted. And so Laura's like, okay, you gotta see what I have here. I got like this brown bag of all my research and papers and all the old, doctor's notes and everything else. So I'm like, yeah, I want to see it. So she literally brings me like a grocery bag filled with like papers, right?
Stuff. Yeah, it was in my drawer. It's been sitting in there forever. Studies that were done. I mean, my husband and I would go to conferences all over the states. There have been brave doctors talking about this, doing these studies for years that have just been buried. So yes. So he was like, wow, okay. So he took everything and copied it.
And learned everything that she had in the brown bag. And that was like 2018, and my practice continued to grow. And we really didn't promote it. It was just kind of very organic, very word of mouth. Actually, one of the first patients that I did an explant surgery on somehow was involved in creating Facebook groups. And so she created my own Facebook group for breast implant illness. I never created it. I didn't ask her to create it. She just did it on her own.
Yeah.
And she's like, Dr. Pryor, you should have like your own Facebook group for breast implant illness. And that really kind of helped kind of fuel the growth. So we went from 10 to 20 to 50 to 100 to 400 to, what did we have when you started?
Well, we had almost 300 when I started. We now have 1,300.
Yeah, so
and I've
maybe
been here 2 years.
Yeah, so it's probably been around for like a year at that point. So maybe, we met in 2018, and then, probably like by, 2019, let's say, I had this kind of Facebook group, and we were continuing to see more and more patients that were coming in with breast implant illness and had symptoms, and we did their surgery and en bloc capsulectomy. Sometimes with the lift, sometimes without, sometimes with fat, sometimes without. That was kind of our gold standard treatment. But, universally, patients got better. And so, that was really what was fueling the growth. We weren't spending ad dollars. We weren't promoting it. I wasn't even talking about it. I wasn't doing stuff like this. I wasn't doing research. Very, very organic word of mouth. We had this Facebook group at the time. And then 2020?
2 years ago.
2020. And then, did you reach back out to me?
I did.
Okay.
So I had decided, I woke up one day and I knew that I was not done. I just felt that, God was not done with me. And I called Dr. Pryor, and my exact words were, I think I want to advocate again. And he said, I've been waiting for you. So this beautiful, I hope you feel the same way, this beautiful marriage happened, and we have, we're kind of, I like to say we're the dynamic duo.
Yeah. So you reached out in 2020, you're like, I want to advocate again. And actually, believe it or not, I was being pushed at that time to stop doing breast implant illness surgery and explant surgery. I just said, no, I'm not going to do that. And so, Laura actually came on board. We said, we're going to really double down on what we're doing with breast implant illness. And we're going to invest in basically like a full-time advocate that's going to help us be better and, allow us to provide a really kind of high-level patient experience that nobody else does for this group of sick patients. And we really think we're doing good in the community and in plastic surgery. We're all about improving quality of life, and that's something that we can do whether or not we're improving the appearance of somebody's face or taking implants out and helping patients feel better. We're trying to improve patients' quality of life. So I was really motivated to kind of go down this road, even though there were some challenges. And I wouldn't be able to do that without kind of Laura's support at that time. So back in 2020, she came on board, and we really just started focusing on, providing the best outcomes and experience for patients that were coming in with breast implant illness. There was a lot of traction, there was a lot of interest. Patients continued to talk about their experiences here and getting better. And we were invited to speak to a group of medical students at University of Illinois about breast implant illness. And I think we were just invited to speak about something. Mm-hmm. And I said, well, let's talk about breast implant illness. And so we spoke to a group of medical students. This is probably like 2021, just over Zoom. It's the middle of the pandemic, actually. So it was like a research type of symposium. And so we did something similar to this. And then, from there, we had one medical student that, maybe reached out to us and said, what you're doing is really interesting. can I come shadow you one day and kind of see what you're doing clinically? I want to see what these actual transformations are like from the patients that you're seeing in clinic. And by the way, I'm also interested in surgery, so can I come kind of see the surgery? So we said, sure. I'm on the staff at University of Illinois, so the student came in and they're like, this is really cool. I'd like to do some research. I want to get into plastic surgery, and obviously very competitive, and this is like something that I think I can really get behind. Do you have any research I can do? I think we can put together some publications and some information that would allow us to eventually be published and kind of continue to build what we were doing to bring awareness to the scientific, medical, and general population, and just continue to build this center of excellence through clinical outcomes and research. So one medical student kind of led to two, led to four. Hi, I'm here with Dane Hester. He's a third-year medical student at University of Illinois in Rockford. He actually just got 2 awards, right, for scholarship recipient for outstanding academic excellence. And he's been working with the Pryor Health team, the breast implant illness team, on putting together some research related to breast implant illness for probably about the last 9 months, 12 months, something like that. And obviously he showed an interest. I think you actually rotated on the service, and then from there he showed an interest in learning more about breast implant illness and hopefully contributing to the development of additional scientific data and protocols related to breast implant illness. So that's also something that we're interested in doing, and there is a paucity of data available. So Dane is one of 4 medical students that we have currently at Pryor Health working with our breast implant illness team on better defining a couple different areas of breast implant illness. Everybody's got a little bit of a different niche within breast implant illness. His in particular is focusing on capsular contracture. So what he's performing now is called a retrospective chart review, which basically means we're trying to get information from looking at the charts of patients to determine if there were some particular risk factors that the patients had that contributed to the development of symptoms related to breast implant illness. And so one of the theories or hypothesis related to breast implant illness is that there's an inflammatory underlying cause in some patients for whatever reason that contributes to these symptoms, that develop these systemic symptoms. And it's also very similar to capsular contracture, and there's a little bit more known about capsular contracture than breast implant illness. So we hypothesize that there's going to be a correlation between capsular contracture and breast implant illness. Ultimately, it's kind of a different presentation of the same underlying etiology or pathogenesis, meaning that there's something that's causing this inflammatory reaction, which is kind of outside the norm for what we typically see as an immunologic response to breast implants, that either manifest as capsular contracture or kind of go on to a spectrum of further inflammation culminating in breast implant illness. And potentially, this is kind of outside the scope of today's presentation, that might even progress further to different types of cancers that are now being found inside the actual cancer, which all have a common underlying etiology of the inflammatory process that's not being turned off like it should be after kind of a typical response to injury. Just like a keloid is an exaggerated inflammatory response to an injury, whereas most people develop a scar and it goes on and heals and that process turns off. In some patients, because of genetic predisposition, they go on to develop hypertrophic or keloid scars. And so my hypothesis is very similar for some reasons that we can talk about again outside the scope of this presentation, but patients are genetically susceptible to having this prolonged inflammatory response to breast implants that ultimately culminate in either capsular contracture or even potentially more severe breast implant illness, symptoms related to breast implant illness, and potentially kind of on the other end of the spectrum, a breast implant associated type of cancer like ALCL or squamous cell carcinoma or other lymphomas that we're now discovering have been found within the actual capsule of breast implants. So all of that being said, our hypothesis was that the capsular contracture would potentially predispose patients to developing breast implant illness in a subset of patients, because they are essentially a different side of the same coin, resulting from the same inflammatory process in some patients and not others. And that isn't fully known as to why that happens. But the most prevalent theory regarding capsular contracture is that it's related to a quote-unquote biofilm that forms around the implants, which basically means a bacterial contamination. The body's surveillance system works really well when there isn't any foreign material present, because it can identify foreign invaders, bacteria, virus, and other pathogens and clear them. But with the actual presence of a shell, inorganic shell, like in an implant, any kind of implant, that predisposes the body's surveillance system to potentially not be able to eradicate or clear the pathogen because it's not in a vascularized setting. So that contamination on the implant, or that biofilm, could potentially be what's contributing to the development of this ongoing inflammatory cycle that ultimately ends up in capsular contracture or symptoms of breast implant illness. And so we have not finalized the data collection yet. We have to look further into the specifics of each patient chart to better identify where there is a correlation, and then do the statistics to determine how much of a correlation there is, and try to identify if this is something scientifically that we can prove. And so once we have that finalized, he'll be putting together an abstract for publication, and ultimately a publication in a scientific journal. Hopefully that will help contribute to have additional information and awareness present in the medical community to, again, just continue to identify and help patients that are suffering from symptoms of breast implant illness. Thoughts?
No, I think you hit the nail right on the head with all of that. Main thing is that it's a deranged immunological response to a foreign body that continues on, that looks like a spectrum of a disorder that we are trying to identify and provide some information for these patients, so that and to the scientific community, so that we can show true data on this topic, so that we can provide information to everyone, the scientific community, and to those who are suffering from breast implant illness.
Yeah, and I think one of the limitations, obviously, of this study and in the breast implant illness community is what's called the power of the study, meaning we just don't have a lot of numbers. So we would have to put together a number of different studies to have sufficient data to make it statistically significant. But we're going to use the information that we have and the patients we have available to try to put together something that's as scientifically validated as possible.
So the most interesting thing I learned was actually coming in and seeing a patient with breast implant illness and putting a story of a patient with the actual study that motivates me so much more to put this study together and do this research for these patients that are suffering from this disease. So that's the one thing that I learned most, that this is a derangement in immunology, that this goes back to, like Dr. Pryor said, our body working kind of against itself, and this could be a reason why several patients with breast implants end up having autoimmune disorders that could be cured from treating this underlying problem. So there are several patients out there that are probably living with lupus and other immunological problems that are as a result of their breast implants, and I think that these people deserve to have answers, as well as the scientific community and clinicians, to make decisions and inform patients in their offices the risks and benefits of undergoing breast augmentation. So that those are all the things that have been really important lessons that I've learned during this study.
That's great. Thank you. Yeah, obviously, I agree with everything you said. There's definitely the need for informed consent process in every patient surgery. And you rotated on the service, so you saw these patients firsthand.
Yeah.
And so I'm just curious, what was your initial impression when you started to work with me, I believe, and you saw patients in the recovery period that said how much better they feel, and just how it's changed their lives. What was your initial thinking or impression?
Yeah, so initially, I was a bit of a skeptic. I would say that, I didn't think that we would see such a profound change after the explantation to the complete resolution of symptoms. Not every patient has a complete resolution of symptoms, but this one in particular did, and it was actually quite beautiful getting to see that patient after explantation with fat grafting to the breast. Actually was happier with her breasts after fat grafting and happier with the way she felt post-explant. So getting to see and listen to that story was an extraordinary experience.
Awesome. Well, we expect great things from the young Dr. Dane.
Thank you.
As he continues to finish up his medical education and hopefully get into a surgical residency. I'm advocating for plastic surgery, and I think that's the direction you're headed.
Yeah.
So we look forward to great things from you in the future. So
Thank you.
Appreciate it. So we're here with Shahina. She's also a third-year medical student at University of Illinois in Rockford, and she's doing a really interesting study as part of a grant through underserved patient populations here at University of Illinois in Rockford, and specifically looking at microorganisms and the pathogenesis of breast implant illness. Very similar to Dane, the other medical student's publication related to biofilm. Kind of if you look at the progression of breast implant illness, the hypothesis is it starts with contamination or microorganism, contamination of the implant and capsule that potentially progresses to development of inflammation, which we measure with inflammatory markers, and ultimately culminating in potentially capsular contracture, which has been implicated in the development of breast implant illness, with a common cause of biofilm ultimately related potentially to contamination of the implant with pathogens.
Hi, my name is Shahina Gatawala. I'm an M3 at UIC College of Medicine, Rockford campus. And my project is the microorganisms and the pathogenesis of BII. So after conducting a literature review, I found scant evidence of research papers describing organisms such as Propionobacterium acnes and extreme amounts of staph epidermis in explanted breast implants. However, there isn't significant evidence that points to these specific organisms being the exact cause of breast implant illness symptoms. So the objective of my project is to have the breast implants that are removed from the patients be swabbed and then analyzed for microorganisms in a local lab in Rockford. After that, I want to be able to take the microorganisms that we find, if we find any, and extrapolate on the symptoms, find a correlation between the microorganisms we find and the plethora of symptoms that consist of breast implant illness. So that is the overall overarching goal of my project. I was interested in this project because I remember Dr. Pryor mentioning that there have been negative labs from the patients before, and so I want to see if there is a potential to have a larger subset of patients to test this theory on. So let's see what we find, and hopefully it's enough evidence to make breast implant illness be an accepted diagnosis in the medical community. Shadowing Dr. Pryor and seeing the capsules of those breast implants being removed, it was just shocking that that's even within the body. So after hearing that Dr. Pryor didn't really have any positive lab findings from these patients that he removed the breast implants from, I really felt that I really wanted to explore this. Maybe from a few patients there's nothing, but if we have a larger subset of patients, maybe we'll be able to find something. Because in these scant papers, there is evidence of certain normal bacteria being there's such a large quantity of those bacteria that there has to be some type of connection that we can make and potentially contribute towards breast implant illness being an actual diagnosis accepted by the medical community. I mean, I feel like there has to be a cause and we just don't know it yet.
All right, so now today we're here with Danielle. She's a second-year medical student at University of Illinois in Rockford, and she's going to present her work on a research project that she's been diligently working on related to breast implant illness. Actually has funding through the university, so with that, I'll let her take it away.
Hello everyone, thank you for having me. To start, I'd like to touch on a little bit of background about my study. So CD30 is a receptor that's found on both T cells and T regulatory cells. Its function particularly is involved in the two-signal model in order to start inflammatory processes and anti-inflammatory processes within the body. And it does this by interacting with its co-receptor CD30L that is found on dendritic cells. And so for our study particularly, we are interested in CD30 and CD30L interaction corresponding to its attachment to T regulatory cells. Looking at the literature, it says that CD30 and CD30L interaction plays a role particularly in transplantation tolerance and graft versus host disease. In fact, in a specific study, as you can see here in 2007, researchers inhibited the interaction of CD30 with CD30L, and then there was an inability to control the ongoing inflammatory reaction within the body. So what this is basically telling us is that CD30 and CD30L play a very important role in suppressing inflammation within the body, and it is very important in regulating and preventing autoimmunity that can further occur. But as Dr. Pryor mentioned, we are specifically looking at serum CD30 in the body. And so serum CD30 is the extramembranous region of the CD30 receptor once it gets cleaved by a metalloprotease. And when this occurs, it basically circulates in the tissue and can be released into the bloodstream where it can be measured. The problem with this, however, is serum CD30 can still attach to its CD30L receptor. And when it does this, it blocks further interaction with the CD30 receptors that are still attached to the T regulatory cells, which means that anti-inflammatory processes cannot occur. So researchers have been exploring this interaction and this blocking and in autoimmune diseases. And what they found is that in Sjogren's, rheumatoid arthritis, lupus, Wegener's granulomatosis, Graves' disease, and Hashimoto's disease, there's a significant increase in serum CD30 during these disease processes. But this has yet to be studied in breast implant illness. And so what we would like to do in our study is analyze serum CD30 levels both before and after explantation surgery in our breast implant illness patients, with the hypothesis that serum CD30 levels will be significantly increased in patients prior to their explantation surgery, and then we will see a significant decrease after their explantation surgery. And if this hypothesis holds true, implications for this study will allow us to better learn the etiology of breast implant illness and the pathways that are occurring in the body. It'll also allow us to better understand breast implant illness's relationship to other autoimmune diseases and potentially lead us to a diagnostic marker in breast implant illness, which would be very helpful for future patients. The overall impact that this disease truly has on its patients, and that it's still a diagnosis of exclusion, which basically means that we don't have specific criteria to diagnose breast implant illness, and there isn't a diagnostic marker. But that, research is still ongoing, and so I think that when you learn about the impact that it has on its patients, it's really kind of like a push to get you involved and get you to ask questions and get you to look into the illness more. Currently, our study is still ongoing. If you have any questions or comments, feel free to contact me at the email address listed here. Thank you.
Well, now I'm here with Claire. She's a third-year medical student here at University of Illinois in Rockford. She's actually performing 2 studies with us, overachiever, of course. She's part of the James Scholar program, so obviously very bright. And her 2 studies focus on the influences of MTHFR, which is a genetic mutation, on the development of breast implant illness, as well as measuring inflammatory markers before and after surgery to better demonstrate the scientific basis of breast implant illness. So we're definitely excited that she has decided to work with us on BII and look forward to great things from her.
Hi, my name is Claire Rosler. I'm a third-year medical student at University of Illinois. So the reason I came to medical school was to be a patient advocate. When I was much younger, I had a really bad back injury, and I bounced from doctor to doctor to find out what was wrong with me. and nobody could. And they told me the pain was in my head and I should learn to live with it or to see a psychiatrist because there was nothing wrong with me. But finally I found a doctor who listened, and because of it, I no longer have pain. And that's why I really resonated with BII and why I really want to study it and, help empower women to know what's going on with their bodies. There's so many women that are suffering and nobody listens to them. And I don't know what it's like to have BII, but I know what it's like to not have your doctors listen to you. I have 2 projects that are ongoing for BII. The first one is looking at the relationship between MTHFR and the development of BII. So MTHFR stands for the methylene tetrahydrofolate reductase protein, encoded by the MTHFR gene, and it is involved in the inflammatory process in the body. So given that its involvement in the inflammatory process, it's been hypothesized that certain women that have mutations in this gene will go to develop BII. So the purpose of this project is to determine if a relationship exists between mutations in the MTHFR gene and the development of BII. The next study is to assess the surgical removal of breast implants as a potential management option for breast implant illness. So there's currently no standard management for BII. Some people argue that removal of implants, termed explantation, resolves symptoms, but other studies have found that there's no change in symptoms. So this study will be assessing inflammatory markers before implants are removed and also afterward to see if there's any change in inflammatory levels in the body.
They're brilliant, all of them, and they've been very independent in putting together their own studies, getting funding, which is not easy. All of their studies, I think almost all of them, maybe 3 of the 4 of them are funded through grants and scholarships, which is amazing, through different programs at the College of Medicine. As far as, quote unquote emerging trends in breast implant illness, I think our clinical outcomes continue to speak for themselves. Almost universally, patients get better after surgery. I mean, the proof is in the pudding there. So like Laura said, you can't make this shit up. I no longer put in implants. I stopped that around the time that Laura came on, just because I wasn't comfortable taking them out and putting them in. Here at least at Pryor Health, we're trying to, like I said, continue to provide resources to as many patients as possible. And so the best way that I know that we can do it is not through just doing more surgeries, but is through educating the next generation of surgeons. We're in the process of starting the first only in the U.S. Explant fellowship. We actually have a fellow with us now that will be our inaugural fellow that's kind of learning the way that we do breast implant surgery and manage those types of patients, so that when he goes out into practice, in a year from now, he can be continuing to do that work, coupling that with kind of our own core philosophy of not only helping patients look better but feel better. We're going to be continuing to add additional service lines that will help patients not only go through the surgical process, but the detoxing is very important.
The nice thing about it's all different pieces of the puzzle to make this all work. It's just now getting explanted. It's the mental, like Dr. Pryor said, it's the mental support to be prepared for this type of surgery. We got them for a reason.
We really think this is kind of the marriage that's going to allow surgeons to be successful and patients doing these types of surgeries, because we want to make sure that we can bring awareness to the importance of not only having advocates like Laura work with the patients, but having outside resources, like we said, that can help them with kind of the mental health journey as they go through the explantation, surgery, and recovery.
So he's like, here she goes. This is when he usually gets up and walks away because he doesn't know what to do with me. Stop it. So I've said it before. I've said it till I'm like blue in the face, but we truly do need more brave doctors like Dr. Pryor. We were in surgery one day. I witnessed every single surgery that he does. I'm in there with him. And I did say to him one day, I said, did you know when you got into plastic surgery that you would be saving lives someday? It is giving children back their mothers. It's giving husbands back their wives. So, I thank you from every single patient. I wouldn't be with anybody else.
Hopefully this has been informative and, just kind of giving you an overview of what's going on in the breast implant illness community. It is starting to get additional traction and being talked about at the scientific level, and academic circles and at meetings and in society. So we do see this continuing to improve, and we think we're heading in the right direction. So it's still very much kind of a grassroots approach and making sure that we're just taking care of the patients one at a time and doing what we can to continue to bring awareness to this, really kind of global problem right now. So thank you for your attention.
Thank you.